Physiologic changes. The wooden bowl. A frail old man went to live with his son, daughter-in-law, and 4-year-old grandson. The old man's hands trembled, his eyesight was blurred, and his step faltered. The family ate together at the table, but the elderly grandfather's shaky hands and failing sight made eating difficult. Peas rolled off his spoon onto the floor. When he grasped the glass, milk spilled onto the tablecloth. The son and daughter-in-law became irritated with the mess. "We must do something about grandfather," said the son. "I've had enough of his spilled milk, noisy eating, and food on the floor." So the husband and wife set a small table in the corner. There, grandfather ate alone while the rest of the family enjoyed dinner. Since grandfather had broken a dish or two, his food was served in a wooden bowl. When the family glanced in grandfather's direction, sometimes he had a tear in his eye as he sat alone. Still, the only words the couple had for him were sharp admonitions when he dropped a fork or spilled food. The 4-year-old watched it all in silence. One evening before supper, the father noticed his son playing with wood scraps on the floor. He asked the child sweetly, "What are you making?" Just as sweetly, the boy responded, "Oh, I'm making a little bowl for you and Mama to eat your food when I grow up." The 4-year-old smiled and went back to work. The words so struck the parents that they were speechless. Then tears streamed down their cheeks. Though no word was spoken, both knew what must be done. That evening, the husband took grandfather's hand and gently led him back to the family table. For the remainder of his days, he ate every meal with the family, and for some reason, neither husband or wife seemed to care any longer when a fork was dropped, milk spilled, or the tablecloth soiled. Many changes are going to happen in the human body as it begins to age. With the integumentary system, we see senile lentigo, which is the decline of the melanocyte activity with age. We see those age spots or liver spots. They're darkened areas on the skin that are exposed to sun. Seborrheic keratoses are slightly raised wart-like macules that have distinct edges. They can be light tan to black, and these are benign conditions. Cutaneous papilloma or skin tags are also called acrocordons. These are also benign skin growths. Crow's feet or wrinkles begin to appear due to the decreased elasticity of the skin and the thinning of the epidermal layer. Harsh chemicals, sun exposure, and dry skin can cause this appearance earlier. Thinner skin also puts older adults at increased risk for skin tears. Thin skin and loss of elasticity will also cause sagging of the skin. Faded hair color or gray color is due to pigment loss. Hair distribution patterns are going to begin to change. Body hair will begin to thin on the head, axilla, and pubis. It may become thicker and more noticeable in the eyebrows, nose, and ears, and women may begin to grow facial hair after menopause. Fingernails are going to grow more slowly. They may also become thicker and more brittle and develop ridges. Toenails become thick. Fungal infections are common under the toenails. Clients become less tolerant to heat because of a decrease in sweat gland function. We see xerosis or dry skin, which is also a result of those decreased sweat gland or sebaceous gland function. Senile purpura is due to that fragile capillary wall. They're red, purple, or brownish areas that look like large bruises. There's a decreased cellular fluid that can cause clients to be at an increased risk for dehydration. And we see decreases in subcutaneous tissue, especially visible in the hollows seen around the eyes and the clavicles. Some of the common disorders are going to be basal cell carcinoma and melanoma, so we need to always monitor skin changes and mole changes. Pressure injuries from a decreased amount of subcutaneous tissue will increase the risk of pressure injuries over those bony prominences. Inflammation and infection. Older adults are going to be at an increased risk. Rosacea is dilated blood vessels on the nose and face that can lead to thickened tissue. Contact allergic and seborrheic dermatitis are common. Herpes zoster, fungal, yeast, and bacterial infections, infestations with scabies, and hypothermia due to decreased subcutaneous tissue. In the musculoskeletal system, we see decreased bone calcium beginning around ages 30 to 40. This causes a loss of bone mass and is greater in women than in men. We see a loss of height. People can lose as much as 2 inches by the age of 70. There's a decreased fluid in the intravertebral discs, and clients can become hunchbacked, otherwise known as kyphosis. There's a decreased blood supply to muscles, a decreased tissue elasticity, resulting in less flexibility, decreased muscle tone and mass, resulting in decreased strength. To keep those bones strong, we need to encourage an adequate intake of vitamins A, C, and D, encourage weight-bearing activities such as standing and walking, and hormone balance. Different conditions may include osteoporosis, which occurs from an excessive loss of calcium with insufficient replacement. It causes porous, brittle, fragile bones that are susceptible to fractures. It is most common in small-framed Caucasian or Asian females. And degenerative joint disease, which includes osteoarthritis, which is the most common form of arthritis. It is more common in women and increases with the risk of obesity, joint injury, or joint overuse. It may require joint replacements. Rheumatoid arthritis is another DJD, and it is an autoimmune disease that causes inflammation of the synovium, damage to the cartilage and bone of the joints, and instability of tendons and ligaments that support the joints. These clients are going to have bilateral symmetrical joint changes. Bursitis, another DJD, is inflammation of the bursa and is more common in older adults. And gouty arthritis is the deposition of uric crystals in the joints and other tissues. This one is more common in men and postmenopausal women. With the respiratory system, we have a decreased elastic recoil, tissue elasticity in the alveoli, and the lower lung, which results in diminished air exchange. We see a decreased body fluid that results in drier mucous membranes, decreased number of cilia, so less debris is trapped and removed, a decreased number of macrophages that increases the risk for respiratory infection, decreased muscle strength and endurance will decrease the ability to breathe deeply and cough forcefully, a decreased number of capillaries will decrease gas exchange, and an increased calcification of cartilage will increase the rigidity of the rib cage, which will decrease lung capacity. So common disorders are going to be chronic obstructive pulmonary disease, which include asthma, emphysema, and chronic bronchitis. These COPD clients are at an increased risk for infections, which is increased further in the older adult because of age-related changes. Influenza, which is a highly contagious respiratory infection caused by viruses. Older adults are going to be at a higher risk of complications, with an increased risk if the older adult has a history of respiratory disease or other comorbidities. Vaccination should always be encouraged. Pneumonia is caused by bacteria, viruses, fungus, chemical, or mechanical agents. The bronchioles become clogged with secretions that interfere with the exchange of gases. Older adults may not have a fever or leukocytosis because of age-related changes. And tuberculosis, which is an infectious disease spread by airborne droplets. Skin tests in the older adult are not very reliable, though. These clients are at an increased risk for contracting TB if they're malnourished, have crowded living conditions, poor sanitation, or a history of systemic disease. And finally, lung cancer is one of the most deadly forms of cancer. It's most often seen in clients over the age of 65. These symptoms are going to resemble pneumonia in the older adult. The treatment of choice will be surgical resection, but it does have a high mortality rate in the older adult. The cardiovascular system is less effective. It has a less effective function with age. We see a decreased cardiac muscle tone that decreases cardiac output. There's an increased heart muscle mass with the left ventricular wall thickening, and that causes a decreased cardiac output, which increases the risk of heart failure and decreases peripheral circulation. There's a decreased elasticity of heart muscle and blood vessels, a decreased number of pacemaker cells, which increases the risk of conduction abnormalities, decreased baroreceptor sensitivity, which decreases adaptation to blood pressure changes, an increased incidence of valvular calcification, which causes more heart murmurs. We see increased atherosclerosis, which increases blood pressure. And older adults have increased risk of orthostatic hypotension because of their inability to respond to those postural changes. And dependent edema and varicosities are common because of sclerotic vein changes and less effective heart function. Common are relatively asymptomatic. Myocardial infarction mortality rate is going to be higher in the older adult. They die suddenly more often. Coronary valve disease. We see calcium deposits on the valves that result in mitral valve prolapse or mitral regurgitation, which then leads to heart failure. Cardiac arrhythmias are increasingly common in the older adult. Congestive heart failure is usually a problem of the older adult. Many older adults see the heart failure symptoms as normal symptoms of aging, and they don't seek help until serious problems develop. Cardiomegaly is not routinely seen in the older adult, but it's not uncommon. And peripheral vascular disease. Occlusive peripheral vascular problems or thrombus is often seen in the immobile older adult. Varicose veins are often seen in the older adults that are obese, inactive, or spend long amounts of time standing because of decreased vascular muscle tone. And aneurysm development is common in the older adult with arteriosclerotic blood vessel changes, a history of angina, MI, or heart failure. And hypertensive disease is prevalent in the older population. The hematopoietic and lymphatic system changes include increased plasma viscosity because of total body fluid volume decrease. We see a decreased red blood cell production, a decreased mobilization of neutrophils, increased immature T cell response, although the total amount of T cells doesn't decrease. This will increase the risk of the older adult to develop infections, including those nosocomial infections or hospital-acquired infections, a decreased immunity to tetanus and diphtheria, and infection symptoms might be more difficult to recognize in the older adult because of the absence of fever and chills with pneumonia, or a lack of dysuria with UTIs, and an absence of pain with peritonitis or appendicitis. Anemia is going to be an inadequate level of the red blood cells or hemoglobin, and it's most commonly observed in older adults. And this will include iron deficiency anemia, pernicious anemia, and folic acid deficiency anemia. Leukemia would be the excessive production of immature white blood cells. So, question. The body's natural pacemaker is? That is C, the sinoatrial node. So the gastrointestinal system changes include increased dental caries or tooth loss, which decreases the ability to chew and take in adequate nutrition. A decreased thirst perception, which increases dehydration and constipation. A decreased gag reflex, which increases the risk of choking and aspiration. Decreased muscle tone at the sphincters, which increases heartburn. Decreased saliva and gastric secretions, which slows digestion and interferes with nutrient and medication absorption. Decreased gastric motility and peristalsis increases flatulence, constipation, and bowel impaction. And a decreased liver size and enzyme production decreases the ability to metabolize medications, which increases the risk for toxicity in the older adult. Different disorders that we may see would be the hiatal hernia, which is a protrusion of the stomach into the thoracic cavity. This risk will increase with obesity and an age over 50. Gastroesophageal reflux disease, or GERD, often occurs with hiatal hernias and increases the risk for aspiration in the older adult. Gastritis and ulcers are going to be inflammatory changes in the mucosa of the stomach or duodenum. Older adults don't have classic pain with it, but they have a generalized pain, decreased activity and appetite, and weight loss. Medical treatment is encouraged instead of surgery in the older adult. Diverticulosis and diverticulitis are small pouches in the intestinal mucosa, and they can become inflamed. Half of Americans are going to have some diverticuli by the age of 60. Colorectal cancer risk is going to increase as we age, so routine screening is recommended after age 50. Hemorrhoids are varicosities of rectal or anal tissue, and they're frequently seen with constipation or obesity. Rectal prolapse or bulging of the rectum through the anus is most likely to occur in women older than 60 and who have had multiple pregnancies and deliveries. The urinary system, we see the kidney size decreasing and a loss of 1/3 of efficiency by the age of 70. We see a decreased number of functional nephrons that result in decreased filtration and removal of drugs. We see a decreased blood supply, which decreases the removal of the body waste and increases urine concentration. We see a decreased muscle tone that increases residual urine volume. A decreased tissue elasticity will decrease bladder capacity. A delayed or decreased perception of a need to void will increase the incidence of incontinence. An increased nocturnal urine production occurs, and an increased size of the prostate in the male, which increases the risk of infection, hesitancy, and frequency while decreasing the stream of urine. So common disorders seen with aging is urinary incontinence. It's not normal, but it is common in the older adult. Urinary tract infection incidence will increase with age, especially in women. And chronic disease, kidney disease, is often a result of chronic health problems such as hypertension, diabetes, and chronic UTIs. So question, aging results in, that will be A, reduced urinary bladder size. In the nervous system, we see a decreased brain size and weight because of decreased cerebral cortex volume. We see decreased cerebral blood flow that makes the older adult more vulnerable to depression, a decreased number of brain cells that slow the thought processes and decreased ability to respond to multiple tasks, a decreased number of nerve fibers, which decreases reflexes, coordination, and proprioception. We see a decreased amount of neuroreceptors, decreasing the perception of stimuli, and a decreased peripheral nerve function, which decreases motor responses, and there's an increased risk for ischemic paresthesias in the extremities. So different disorders are going to be Parkinson's, which is a progressive degenerative disease of the central nervous system. Symptoms usually are going to begin after age 40 with an increased incidence in the older adult. These clients may also develop dementia. Dementia is a permanent and progressive mental disorder characterized by personality changes, confusion, disorientation, deterioration of intellectual function, and impaired memory, judgment, and impulses. Alzheimer's dementia is going to be the most common form of dementia, and it can be common in people over 65. It is more common in women due to increased longevity. Transient ischemic attacks, or TIAs, are brief episodes of cerebrovascular insufficiency, usually because of obstruction. It usually lasts only a few minutes, but can last up to 24 hours. It may be a warning sign of an impending stroke. And strokes are cerebrovascular accidents, or CVAs, that cause a disturbance of the blood supply to the brain. It most commonly happens in people over 65 years of age and slightly more often in men than women. It is a leading cause of disability in the older adult. Ischemic strokes can occur because of a lack of blood and oxygen, either from an embolus or a thrombus. And hemorrhagic strokes can occur when there's a weakened blood vessel or aneurysm that ruptures spontaneously or because of hypertension. So with the eyes, we see a decreased number of eyelashes that increases the risk for eye injury. A decreased tear production, which increases the potential for eye irritation. Increased discoloration of the lenses decreases color perception. Decreased tissue elasticity will increase blurring. Decreased muscle tone will decrease the diameter of the pupil, night vision, and peripheral vision, and increases refractive errors and sensitivity to glare. Refractive errors can cause an inability to focus. The eyelids are going to be less elastic and they begin to sag, and those eyelashes are going to be shorter and thinner. And a grayish haze of the peripheral cornea, known as arcus senilis, will develop. Different disorders will include blepharitis, which is a chronic inflammation of the eyelids. Diplopia is also known as double vision. And cataracts can cause a clouding of the lens in the eye. It's increasingly common with aging, and that's what you're seeing in the slide. Glaucoma is a disease where there's an increased intraocular pressure in the eye that causes damage to the retina, and the incidence of this disease increases with age. Age-related macular degeneration will occur most often in people over age 50. It's more common in white people. Vision will be decreased with the dry form, and it can be actually lost with the wet form. Retinal detachment will be the separation of the retina from the choroid. It can be caused by normal shrinkage of the eye and changes in the consistency of the aqueous humor. So with the ears, the tympanic membrane is going to begin to thin. We see decreased tissue elasticity that causes decreased ability to distinguish high-frequency sounds. A decreased joint mobility will decrease hearing ability. We see decreased ceremonous cells in the external air canal that increases the risk of impaction of cerumen, which causes conductive hearing loss. Atrophy of the vestibular structures and the structures in the inner ear are going to cause an increased balance problem. Presbycusis is a hearing loss that's associated with aging, and it affects more than half of the adults over 75 years of age, affecting men more often than women. So common problems will be otosclerosis, which is a hardening of the stapes. It interferes with sound wave transmission into the inner ear. Tinnitus is ringing in the ears and commonly is reported by older adults. Deafness is the inability to hear sounds fully. Conductive hearing loss might be found because of an interference of sound wave transmission. Sensorineural hearing loss is due to receptors in the inner ear or the cranial nerves being damaged or destroyed. And central deafness is going to be caused by trauma or disease in the brain's temporal lobes. Ménière disease is a chronic disorder of the inner ear that affects balance and causes tinnitus and hearing loss. Intermittent episodes of Ménière disease can last for minutes or hours. So with some of the other special senses, such as taste and smell, we have a decreased number of papilla on the tongue, and this decreases the ability to taste. We have a decreased number of nasal sensory receptors, which decreases the ability to smell. So question, the most common form of dementia is? This is Alzheimer's disease. In the endocrine system, we see decreased pituitary secretions of the growth hormone, and this leads to decreased muscle mass. We see decreased production of thyroid stimulating hormone, which leads to decreased metabolic rate. We see decreased insulin production or increased insulin resistance, which increases the risk for diabetes mellitus type 2. A decreased production of the parathyroid hormone increases serum calcium, and if you remember, that pulls it out of the bone, so it makes the bones more brittle. Estrogen and progesterone production will drop significantly in women after menopause and causes the development of facial hair and genital atrophy. And testosterone will decrease gradually in men. So diabetes mellitus. Type 1 is not really tied to aging, but type 2 becomes more likely with age. Hypoglycemia would be a complication of taking insulin or oral hypoglycemic agents in the older adult. And hypothyroidism would be reduced function of the thyroid, and it is more common in the older adult than younger adults. Although treatment can reduce bone density in older women, we still will probably treat it. With the reproductive and genitourinary systems, we see in women decreased estrogen levels that lead to decreased vaginal secretions. decreased tissue elasticity, which causes decreased pubic hair, breast tissue mass, uterine size, vaginal size, and an increased fragility of the vaginal tissue, tissue irritation, and pain with intercourse. We also see an increased vaginal alkalinity, which increases the risk for infections. In men, we see change in the size and firmness of the testes, scrotal enlargement. Decreased testosterone levels will cause decreased amount of facial and pubic hair. Decreased circulation will decrease the rate and force of ejaculation and a decreased speed in gaining an erection, and prostate gland enlargement. So common disorders will be uterine prolapse, which is the prolapse of the uterus into the vagina, which can be a common issue with older women. Vaginal infections because of a change in the alkalinity of the vaginal secretions. Breast cancer risk will increase with age. And prostate cancer is a major cause of death in aging men, and it requires regular examinations because of a lack of symptoms. One more question. So according to the Centers for Disease Control, the number of older adults with diabetes is more than how many times higher than adults aged 18 to 44? This will be C, 2.5.